I'm Reverend Dr. Jan Carlsson Bull, and I reside in Middletown, Connecticut. I speak on behalf of SB1076, Medical Aid in Dying, more accurately called Compassion in Dying or Death with Dignity. I come before you as a close friend of Linda Bluestein, for whom this bill is intensely personal. You heard earlier Linda's testimony, and you will hear later from her husband, Dr. Paul Bluestein. You know that Linda, my dear friend, is amid end-stage fallopian tube cancer. And she and her husband, Dr. Paul Bluestein, are passionate advocates for this legislation and have been for many years. My ministry as a Unitarian Universalist minister has been grounded in the belief that God is love. Much as it is impossible for any of us to get into the mind of God and to say God is this, God is that, the God that I believe in is a God of love. And needless suffering is antithetical to my understanding of a loving God. I do not believe that God is sadistic. For those who argue that suicide is against the will of God, medical aid in dying is not suicide. A very dear friend lost his sister to suicide. Brutal. I have also presided at the memorial services of at least 2 or 3 people who committed suicide. Medical aid in dying is not suicide. I have seen and known suicide. Linda does not want to die. She is one of the most vital people I know. She loves her life. But without the option of this legislation, she faces a death that is extremely painful and laden with anxiety, even with palliative care now and hospice at the end, which, is not necessarily divorced from medical aid in dying by any means. But even then, she would face an extremely painful and anxiety-ridden death. Linda and her husband, Paul, are joined in their support by the majority, 75% of Connecticut residents. I know some have argued with the numbers, but these are the numbers that keep coming back. They're also joined by the majority of Roman Catholics and liberal Protestants and disabled individuals. As a minister, how can I possibly forget the congregant who spoke again and again of his late wife and how she died after a harrowing struggle with cancer? She only wanted to pass peacefully, surrounded by her family. And it's ironic that Reverend Sullivan, who testified with such pastoral presence, and he definitely did, talked about how that end stage of life can be redemptive because you can be surrounded by family and talk with people you haven't talked with in years. Precisely. That is part of what Death with Dignity and Medical Aid in Dying is about. So that if you have a very limited time in which to live, you can plan. You may not use that medication, but you can plan to have your family and your loved ones near you as you pass on. And it can be a time of peace rather than a time of trauma for you. And certainly we heard from the gentleman who is an attorney in New York who witnessed the horrible, agonizing death of his father.
Ms. Carlsson Bull, your time is up.
I'll be finished shortly. So Connecticut has not yet legislated this option, but I am so hopeful and beseech you to pass this legislation at long last. Life is a gift, so is a peaceful death. When any of us receives a terminal diagnosis that promises only a death of pain and suffering, where is compassion? Where is mercy when we breathe our last? Compassion and mercy are up to you. Our Public Health Committee, our Connecticut legislators. Thank you, and I welcome your questions.
Thank you so much for your testimony.